So these are just a few tips on when to call your pediatrician. So if your baby's really inconsolable, if your baby has a temperature of 100.4 or higher and they are under 8 weeks of age, your doctor needs a phone call about that right away. Blood in the stool, they should be notified of. If your baby is projectile vomiting, meaning your baby is throwing up where it can hit you across the room every single feeding, that is something you want to bring to their attention. And anytime you just feel like something's not right, right? And certainly over time, you're going to learn more about how to decipher between something that truly isn't right and just your own feelings of worry. But anytime you're concerned, it's reasonable to give them a call, and either they'll calm you down or they'll tell you to come in.
So I'll touch on that. Like, moms know best. There was an incident that my husband and I kind of got into it because our baby was sick, and I said, I think she needs to go in. And he said, well, that's going to be expensive. I don't think that needs to happen. And it was just one of those things that I went with my gut. Brought her in. She ended up being hospitalized. And in those instances, you just have to do what you feel is in your gut, So do not ignore that. That is, huge for me to give. When you say that on use your intuition, moms know best, you've got to follow that.
Yeah. It's, in general, doctors often are working through a protocol and they're doing things. They want to do what's right for your baby, but they're not always as in tune with what your baby is normally like as you are. And as a pediatrician, as a coach, I always really value parents' opinions and moms' opinions, because it's something that doesn't have a replacement. We had a similar situation. Actually, my daughter, she was already 6 years old at the time, and I was up all night with her, and I was sure that she had like appendicitis or something, like something really wasn't right. And I never take my kids to the hospital because, thankfully I can evaluate them at home and all of that. And we took her to the hospital, and the first doctor that saw her had done an ultrasound. The ultrasound came back fine. It wasn't her appendix. And, we sat there and she just wasn't really looking like herself. And it was change of shift, and a new doctor came on, and my husband said to them, like, we're not leaving unless she has a CT scan. Now, I wouldn't say always do that. That's not always. We just both happened to be physicians, and we both kind of knew what the next step was and needed to happen. But we were really speaking from a point of, this is our daughter, something is not right, and not from that, doctor perspective. And she ended up having an ovarian torsion and needing surgery that day. And so, if we had gone home, like, who knows what would have happened? She could have lost her ovary and could have made a big difference for her future status of fertility. Who knows? But when you're really feeling strongly about something, don't be quiet about it. You want to make sure that they know. Obviously, you can be nice about it, but be your own advocate and